Survivors of brain and spinal conditions are meeting to raise more awareness on brain health as they advocate for the training of caregivers in order to provide all-round care for patients. They raised this while sharing some of their experiences at the meeting to mark the Brain Health Awareness Week in Abuja. TVC News Balogo has details.
This room is filled with people who have the same shared journey of finding a cure for brain conditions for their loved ones. Survivors, caregivers, and experts all here have one thing in common. They all have stories to tell. Judith's story is one that has changed her life, interrupting her childhood dreams after going blind through a diagnosis that led to her journey of getting a brain surgery.
They had to rush me to the theater and said that I was suffering from brain tumor cancer, which had already damaged my optic nerves, my pituitary glands, and my growth hormones. So I went through several tests and different surgery. They couldn't remove the tumor, they were only able to shrink it through a radiotherapy.
Chika also narrates her own battle to find a diagnosis for her sister's condition, who was almost near death.
I was just shouting, "Victoria, you're not dying! Victoria, you're not dying! Victoria, you're not dying!" And they now had to stabilize her again in the ICU and said that she was going to undergo a surgery. And that was my first encounter with the word brain surgery.
Like Chika, Patricia also passed through several hurdles in getting help for her 11-year-old son.
He cannot do anything for himself. If he wants to poo, I must assist him. If he wants to eat, he cannot eat. Since that very day till this day, he has not spoken a word. He has lost his speech. He cannot walk. We on 4 times physiotherapy a week, and he wears pampers. He's still on drugs.
Physiotherapy is one of the most important aspects of the journey to full recovery after surgery for brain and spinal injury survivors. This physiotherapist believes caregivers need to be trained to ensure that patients going through this still get all-round attention.
If I'm with a patient face-to-face for 1 or 2 hours in a day, it then means for the rest of the 22 to 23 hours in the day, the patient is not with me. So what the patient is doing or what the caregivers are doing for the patient is very necessary.
Experts here highlight the strides made in recent years through innovative technology and research, but still seek more funding, awareness, and innovative care for the many survivors who still have to live with the damage caused by their brain conditions. Kemi Balogun, TVC News, Abuja.